Yeah, in relapsed and refractory multiple myeloma, which occupies about 80 to 90% of the living population with myeloma, over 100,000 patients currently in the United States, is in need of new therapies. And we've had several presentations here at this ASH conference looking at our drug both alone and in combination with existing therapies in relapsed refractory myeloma. Today we had our 2 oral presentations where Selinexor was combined with drugs known as proteasome inhibitors, and we showed very high response rates in combination in patients with 4 to 5 prior regimens. We had response rates of 77% and 63% in patients treated with combination therapies. The expected rate of response for the older therapies on their own is in the order of 20 to 30%. So clearly an improvement over what was expected. And these regimens are well tolerated and patients were able to stay on them sometimes over a year. As importantly as this combination therapy, which we think will be the future of Selinexor, is to demonstrate single agent activity of Selinexor. So we presented yesterday in an oral presentation Selinexor combined with low-dose dexamethasone, a typical drug, steroid, used in the treatment of myeloma, which has no activity on its own. We give it with Selinexor because it reduces some of the side effects like nausea and fatigue, and because it has shown synergy with our drug. In patients whose disease has progressed despite all of our best therapies, and we categorize these as either quad refractory or pentarefractory. These are terms that we actually came up with and are being adopted now at ASH and throughout the hematologic malignancies community. We showed a 21% response rate overall with Selinexor essentially alone in patients whose disease had progressed despite everything we have to offer. Importantly, patients who responded to Selinexor showed at least a 2 times longer survival than those who unfortunately progressed on Selinexor and had to go get other therapies. So in patients who really have a desperate medical need with exhausting currently available therapies, we were able to show clear activity that seems to be translating into a survival benefit. And finally, yesterday we had a combination study which we're excited about, Selinexor taken by mouth with another oral therapy, making a very convenient regimen, namely with Pomalyst or pomalidomide, which is also taken by mouth. We showed a very nice 60% response rate on top of what would have been a 30% response rate of pomalidomide alone in very heavily pretreated patients with 6 prior regimens. So taken together, what we know is that Selinexor has single agent activity, which is important, but as we look to the future, to combine Selinexor with existing therapies and greatly improve the response rates and presumably the clinical outcomes in patients with relapsed refractory myeloma.